Here's how to bathe a newborn baby. I'm a labor postpartum nurse and I recently gave birth to my third. Believe it or not, newborns do not need to be bathed as often as we think. Two main reasons. First, a baby's skin is pretty delicate and it can dry out so easily. And the second reason, babies aren't getting as dirty as a child or an adult does. They don't sweat as often and it's just not needed. The standard recommendation is to only bathe or give a newborn a sponge bath 2 or 3 times a week. Here's how you do that. While your baby's umbilical cord stump is still attached, we are not going to submerge baby in water and we only are going to be doing sponge baths as needed. Sponge bath is just like a regular bath, but we're not submerging them in water. First off, we want to get our supplies ready to go. It's not typically recommended to use soap. You need a basin or something to hold a small amount of water, some washcloths, and a towel. And if you would like, you can use fragrance-free lotion. Fill the basin with warm water, definitely not hot water. Next, we are going to wet the washcloth. Place the supplies and the baby on a flat surface. This could be the bed, the floor. I'm gonna use a changing table. Place the towel down first, put baby on the towel, take off baby's clothes and baby's diaper. Now I'm gonna start washing the baby. I'm going to be gentle, never leave baby unattended. Keep the baby warm and covered on areas that are not being washed. It's pretty straightforward, gentle motions. Wipe the areas as needed. We're not going to be wiping rough on the baby's eye. Milk and formula can easily get into the baby's neck, behind the baby's ears, all of these crevices. We clean real good. And if your baby has hair, you are welcome to wash the baby's hair. When you're finished washing a body part, just pat it dry and cover that area up. We're going to move on to the next part. And we're going to be rinsing the washcloth in between body parts. Open up their hand, get the palm, get their in between their fingers. They can get a lot of lint in there from their clothes and sleepers. Pay special attention to any rolls or crevices. Do not need to scrub and clean the umbilical cord stump. Clean baby's genitals, clean the front to back. Do not want to go between the bottom back to the front because that can introduce bacteria from their bottom into the urethra and possibly cause a urinary infection. Baby's toes trap a lot of lint in between. Wipe all of that out. When you're finished, if you choose to use lotion, this is a great time to do it. Wrap the baby up in their towel, put a diaper on the baby, get baby dressed, and you are all done. When a newborn's umbilical cord stump falls off, which is typically about 1 or 2 weeks after birth, it can then start to have regular baths. First, we want to get our supplies ready. Fragrance-free baby soap, a washcloth, a dry towel, if possible, an infant bathtub. The goal is to have something that is slope, texture to prevent the baby slipping. There's also infant tubs with slings. You can use a container or basin with a towel lined on the inside of it. If you plan to use a sink, be extra careful. It's more slippery and we don't want to knock the baby's head on the faucet. My supplies ready to go. Turn on the faucet and make sure the water is not too hot. Bathe the baby in 2 inches of water or less. Next, we place baby in the bathtub and we're going to clean him the same way we did with the sponge bath. Like always, the goal is to be gentle, to keep baby safe, never leave baby unattended, and to make this bath as fast as possible because we want to keep the baby warm. Use a damp washcloth, add a small amount of soap. Start at the top, work our way to the bottom. I personally like to lay a washcloth that was dipped in the warm water over the baby's trunk. This extra washcloth will keep the baby a little bit warmer. Take a cup of water, rinse the soap off the baby. To wash baby's hair, we can take the washcloth with a little bit of soap, clean it gently. And to rinse the shampoo out of baby's hair, take a cup right next to the top of the baby's head and slowly trickle it backwards like this to avoid getting any soap in the baby's eyes. When we're finished, I like to take a towel, tuck it under my armpits, reach down and bring baby close to me, and easily wrap baby up. You can move on to applying the lotion and putting the baby's clothes on. For more information on pregnancy, birth, postpartum, newborns, give me a follow, check out my page.